I kind of have a bit of a sordid history with the DSM. When I was getting my undergrad in psychology, the DSM-4 TR had just been released, if that dates me a little bit. And I always had issues with our professors referring to it as the Bible for psychology and psychiatrists. Because that implies some sort of infallibility or like divine nature, when we all know that the DSM is definitely not that. It's more of a living document that is open to revision based on peer review evidence and science and all that good stuff. So just due to opinions and social currents and attitudes in regards to homosexuality, in regards to Asperger's now becoming more of a spectrum disorder and being left off of the five, and substance use disorder, the definitions having changed and the criteria having changed. So looking at it as a Bible always bothered me. As far as positive and negatives in regards to this, I really like that it operationalizes and simplifies the process, which can be a positive and a negative depending on the clinician using it. I have seen psychiatrists meet with patients for 3 minutes, go into their office, look through the DSM, and write down a diagnosis. So that's obviously the negative. However, I believe it does help narrow the scope, and especially when you're dealing with new practitioners, it gives them a starting point where they can go from. I also think it helps demystify the process. You can buy this on Amazon. Anyone can buy it. Anyone can look through it. You can kind of see the criteria for good and for bad. Now, that does lead to self-diagnosis, and it can lead to stigmatization, which they talked about in one of the videos. So, that's kind of a double-edged sword. But overall, I feel that the DSM is a flawed tool, kind of a blunt instrument, but it's a necessary tool. And it's up to us as clinicians and practitioners to kind of sharpen that tool with our clinical assessment skills and refine that in the interviews and interactions with the clients to figure out exactly what's going on. So it's there, you need it, you have to use it, especially in this era of managed care. However, you shouldn't rely on it as your only source of information.